I want y'all to see this image right here on your screen. Just like with the opioid plague and anything else that is tackling palm-colored America, it seems that something that was literally targeting mainly Black America is going in that direction. And now that it has hit that direction or is hitting that direction hard, now they want to make a big stink about it. Watch all these programs and all these cures, quote unquote, and treatments come about for palm colored people who are affected by HIV on a more massive scale. To be honest, they had the numbers there as far as who was affected by HIV, but they never talked about it. But now that it's getting out of control, now they want to do something about it. But when it was about us specifically, then it was, a non-issue. It was just, it's just them because they're Black. Now, the person who wrote this name is Dr. Stephen W. Thrasher, professor at Northwestern University. Now, I don't know if the article I'm about to read is going to say it, but I'll say it right now. In his post, in a tweet that he posted before he posted the link to this article, he even admitted himself that usually when he writes pieces about HIV, it was about the Black community. And then he even admitted that now it's interesting that I'm writing a piece about it affecting rural America, aka palm-colored America. My, how the tables have turned, and they're continued turning. I don't know if you have ever heard of that phrase, canary in the coal mine. We, as Black people, were that canary in that coal mine. Whatever happens to us affects the greater society, if you want to call it that, but it hits them even more harder than it did us. Now I'm going to go ahead and get into this article, and it's coming from the New York Times, and it's a pretty lengthy article, and I want to read every word of it. While there are still about 1 million people living with HIV in the United States, in some of America's largest cities, the news about HIV and AIDS is surprisingly positive. The new HIV diagnosis fall to historic lows, the New York City Department of Health announced on November 22nd. Reporting that the largest city in the United States had fewer new diagnoses of HIV in 2018 than during any year since statistics were first kept in 2001. This was just a few weeks after Philadelphia's Department of Public Health reported a 14% drop in the number of newly diagnosed HIV infections overall, and a drop of more than 1/3 among Black men who have sex with men, in especially vulnerable population. San Francisco and Chicago have also seen their rates of new HIV infections falling. But while robust municipal health campaigns are creating downward HIV trends in some of America's largest cities, in much of rural America, an opposite trend is emerging. There have, of course, always been cases of HIV in sparsely populated parts of the country. But in these places far from cities, the conditions that lead to HIV transmission are now intensifying, and rural America is not ready for the coming crisis. So it now looks like rural America now has another plague on their hands. Indeed, in Appalachian, West Virginia, the crisis has already arrived. Between that and them opioid plagues and whatever else they got in that rat-infested place called West Virginia, I don't know how much longer their population is going to be able to hold on. A cluster of 80 new HIV infections have been diagnosed since early last year in Cabell County. As a Tony Young, an AIDS activist, puts it, the epidemic of opioid addiction, fueled by drug companies' promotion of pain medications beginning in the 1990s, is a crisis in rural regions, in part because these regions are completely unprepared to deal with the magnitude of the problem. No, it's a crisis now because they're mainly white areas. Them saying that they don't know how they were unprepared is a bullshit ass excuse. Because guess what? Black people in black areas back in the 80s and 90s weren't ready for the crack era, the crack drop, I should say, but they didn't say it like this. They made it seem like we went out there and looked for the drugs and we just brought them back to the community. No, that's not what happened. That whole war on drugs thing was a war on black people, and they know it. Ms. Young founded what is now called the Community Education Group in Washington, D.C. in 1993, originally to address HIV and AIDS in women, an African-American lesbian who has spent most of the past 30 years working to help members of the black, gay, and urban community it affects. But since her recent move to West Virginia near the Appalachian coalfields, she's seen the crisis take a different shape. Unlike large urban areas that have dealt with similar health and substance crises in the past, and that have networks of service providers and consumers in place, small rural health jurisdictions often lack the infrastructure to confront the crisis and have little history of dealing with comparable health crises, she explained. See, there it goes right there. They did not expect something like HIV, as widespread as it is, to affect them. That's why they're quote unquote unprepared for it, because they were banking that it would not exit the sphere of urban black areas. They thought that's all it was going to stay in. It was just going to stay in that bubble, but the bubble has burst and it has now spread to these areas that are not prepared to deal with it because, well, as far as they know, for as long as they've been around, it's never been their problem. Well, it is now, and good luck, because since they don't have the proper resources to really combat this thing, it's going to be just like that opioid plague. And it's quite a crisis. Between 2006 and 2016, the Charleston Gazette-Mail reported nearly 21 million opioid pills were sent to a single West Virginia town of 2,900 people. For years, according to the Centers for Disease Control and Prevention, West Virginia has had the highest rate of drug overdose deaths of any state in the country. By 2017, in Jefferson County, 1 in 4 people had a controlled substance prescription, and when prescriptions highs can't be sustained, people often turn to using and sharing needles to inject heroin and then fentanyl, leading to hepatitis C and HIV. This avoidable crisis has been exacerbated by unemployment, declining coal mining production, and economic pressures on regional press to act as effectively as a watchdog. At the same time, healthcare is relatively inaccessible. It's not so easy to get to the nearest town to see a doctor, Dr. Judith Feinberg, a professor of medicine at West Virginia University, explained, pointing to a lack of transportation and stigma as the biggest barriers to testing and care. People living with HIV are stigmatized everywhere, but those who live in large cities can get tested while feeling relatively anonymous in a clinic in ways rural dwellers cannot. Someone please get their ass a tissue to wipe their face, because I don't have one. I really don't. I feel absolutely nothing already, and I'm like halfway through the article already. What's happening in West Virginia shouldn't be a surprise. After a hepatitis C and HIV outbreak in Scott County, Indiana, in 2014 and 2015, that was fueled by deindustrialization and opioids, the CDC released a list of 220 counties similarly vulnerable to such outbreaks among people who use intravenous drugs. The deceased concentration of those counties is along the Appalachian Trail, with 28 of them in West Virginia, more than half of the state's 55 counties. There is no way that doesn't wind up as an HIV outbreak in the state, Ms. Young says. Yet, unlike places in New York, with its comprehensive sex education efforts at queer and trans-specific public health, embrace of public syringe exchanges, and what its health commissioner Oxyrus Barbett describes as a sex-positive approach. When it comes to confronting its HIV epidemic, rural America is ill-prepared at best and antagonistic at worst. For instance, despite research showing that syringe programs are effective at limiting transmission of HIV and encouraging people to enter a drug treatment, 2 cities in West Virginia, Clarksburg and Charleston, had recently moved to close or limit their needle exchange programs. Negative press, business worries, and conservative approaches are among the reasons the program have been reduced when they urgently need to be expanded. I have seen such tragic avoidable public health policies unfold in suburban setting and in my own research in America's heartland. Since 2014, I have been reporting and researching in St. Charles County, Missouri, a white flight suburb to the west of St. Louis, where the local prosecuting attorney charged Michael L. Johnson with multiple felonies for transmitting HIV. Mr. Johnson's conviction was overturned on appeal in 2016. Even though Criminalizing HIV is not effective in decreasing rates of HIV. One of the reasons the county wanted to prosecute and imprison Mr. Johnson was likely to prevent him from transmitting the virus to others in order to protect the public health. Yet in 2017, St. Charles County closed its only clinic for sexually transmitted infections, which provided nearly 1,000 exams a year. With fewer people getting tested and with fewer people living with the virus taking medication that can prevent transmission to others, more people in this area could become HIV positive. While it is true, people who are black, queer, transgender, homeless, incarcerated, or poor, or who use injection drugs are disproportionately affected by HIV and AIDS, the misguided impression that members of these groups are the only ones affected has unfortunately contributed to the media's choice to deprioritize coverage of HIV and AIDS in recent years. Now, that's a very interesting statement that was written right there, because they always focus mainly, especially on black people, when it comes to HIV, because they always at first it was named as the Alphabet Academy disease, and then all of a sudden it became as a black disease. But now, as you can see, it's about to take a new face. It's taking a new shape. And because they've ducked and dodged it for so long, and like they said, that one white flag town, they thought they can get away with it, but now it's coming for them and they don't know how to deal with it. Well, that's their fault. That's their problem. Meanwhile, the rural heterosexual white Americans who have been the subject of countless national profiles because they're imagined incorrectly to represent all of President Trump's supporters are more at risk all the time. But while we're bombarded by analysis of many aspects of their plight, we don't hear this crisis facing them. It's time for that to change, and for policymakers to address the root conditions that allow HIV and AIDS to flourish in rural communities. In West Virginia, this includes increasing access to health care, supporting all workers hurt by deindustrialization, and undoing the stigma tied to sex and drug use. These changes will, of course, provide much needed help for the people in urban cities where HIV rates are dropping as well, but the new major terrain of the crisis right now is in rural America, and it can't be ignored any longer. So you see right here, this goes back to the whole thing what I said about the canary in the coal mine. It affected us, but now it's saying in urban areas, which I guess you could say is a good populace of the black community, is dropping in HIV and AIDS, and it is increasing in the last place they expected it to hit. And because they don't have access to a lot of the things, because they live outside of the city or urban areas, let's just say they're going into a battle without any weapons. And it's about to kick their ass, demolish them. That's what they get for white flight. They thought white flight was going to see. Their ancestors didn't think this through. See, they were doing what they would for what was good at the time, but they didn't know that it would affect them in the long run. Well, here's the long run right here. They didn't think that it was going to happen. I bet if their ancestors were alive right now, they would probably be pissed at themselves for what they did. But then again, many of them don't like to take accountability, so they will probably find some imaginary black boogeyman to blame. I don't know. See, they probably like them N-words. If they just didn't come over here, we wouldn't have to take flight. They probably would say something like that. But this is their issue. This is their problem. They have to deal with it. This is their cross to bear. And like I said, between low birth rates, that opioid plague, and now this, good luck. That 2045 is looking very, very bleak right now. I think the numbers are going to start to go down a little bit, like below 2045, 2030 something. Or even 2040. I'll give them that. Because, yeah, they are in for one hell of a ride with this one. Good luck. But see, they're going to do just like they did with the opioids. They're going to try to find a cure. They're going to try to find all the special type of treatment. All the drugs that were probably so expensive to get. They're going to find a way to get that down to something that's affordable. Because it's them. Look at what they said in the article. They basically was throwing dirt at urban areas for having access to this place. But guess what? They were once a part of those urban areas before they were called urban, but they left when the quote unquote urban element moved in. So whose fault is that? Maybe if they would have stayed, they would have access. That's another reason why they are probably gentrifying everything, is because of this too. I wouldn't be surprised. Now they're going to try to move their ass back in to get access to all of that. But guess what? No one's going to want that element because now you're going to bring all that disease back into those places where the numbers are down. But now they just probably want everyone to just drop what they're doing to take care of them. I'm sorry, but no. This is something that they have to deal with. Pull yourself up by your bootstraps, as they always like to tell us to do. Oh, well, y'all let me know what y'all think about this down in the comments, and I will talk to you in the next one.